Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Friday, December 4th, 2020. So due to the Thanksgiving holiday last week, numbers are still a bit funky, but we'll go through anyway. These are going to be all looking at 2-week changes because we did not have an update last Friday. So worldwide, we crossed 65 million cases with an average of 4.1 million new cases per week over the last 2 weeks. Now that's probably closer to right than any of the US numbers, of course, because they do not celebrate Thanksgiving internationally. Here in the United States, we saw on average 1.2 million per week over the last 2 weeks, which is just like the world cases more or less holding steady with perhaps a slight uptick in recent days, but again, with the numbers being off. And here in Massachusetts, we saw 21,000 new cases per week, which is an increase of about 3,000 new cases per week from where we were last time we checked in. In terms of deaths, worldwide, we crossed 1.5 million with about 70,000 new cases per week, or new deaths per week. Here in the United States, we saw about 12,000 new deaths per week, and here in Massachusetts, we saw 220 per week, which is about an increase of about 2,000 deaths per week in the United States and about 20 per week in Massachusetts. So looking at these graphically, you can see where the lines start to get a little wobbly from Thanksgiving there. Things are shooting back up. Now, some of this increase is a little bit from backlog. But the number that you can always rely on there is the hospitalizations, which has for the first time ever crossed 100,000. 100,000 people in the United States are hospitalized with COVID-19. And the numbers are jumping up, passing 200,000 for the daily cases and getting up to May numbers in terms of deaths. Now, when we check in next week, we'll probably have a better idea of where things really are after the holiday effect has corrected. But we should expect to see these trend up even more. In terms of new cases by state, it's pretty big across the country here. So see where there are now 5 states that are experiencing over 10,000 new cases per day. Here in Massachusetts, we hit an all-time high there, but that does include, from yesterday's data, almost 700 cases from a lab that was backlogged. And you can just see here how it's just skyrocketing here, but we'll get some more accurate numbers again next week. Another thing to look at as well, the week that has the highest single day for any given state has jumped up with a lot of places. Now almost no states are left in the earlier part of the year, just places like Maine, who never has had many cases to begin with, or New York, which of course had the most cases ever, basically, when things were still early on. But now everything is hitting its high right now. It's now, again, there may be some doubling up there this week because of the holiday, and we'll probably know that if we see a similar chart like this next week. If things move, if this week stays as it is, then that might be due to some doubling cases. Of course, given the number of states that hit their highest day on the previous week, we shouldn't hold out hope for that. We may see a lot of these jump to one more week after that. Now, looking at hospitalizations, because these are a much more telling measure, things are just going up steadily across the country, except in the Midwest where things are plateaued there. And maybe the pandemic is burning itself out there, or maybe it's just the hospitals are just getting full and there's just not really room for people, or they're being much more selective about who they admit. Note in the South, they have almost passed the hospitalization numbers from the summer surge, which is very disturbing there. And the West has long since passed, and it's also skyrocketing there. And here in the Northeast, I mean, we're still nowhere near where we were in the spring, but that's a very steep curve there. And just looking at deaths quickly here, because we have hit some numbers similar to May, but you've got to look at how we also had some low reporting days. It takes a lot longer to report deaths than you might otherwise think. So these numbers might come back down again, but given the trend we were on, it's almost like we've kind of picked back up where we left off. This line is the 7-day average, and we're basically back where we were if this had just kept going up. So we should probably expect to see this continue to trend up, and we may well be at a point where we are higher than the spring averages in the next couple of days, with the only difference being that instead of being localized in one area, the Northeast, it's spread across the country. All right, so with that, let's move into developments. A couple of things happening this week. First of all, the biggest news being that the UK approves the Pfizer vaccine for emergency use, and injections will probably be starting in the next week or so over there. So that's very exciting. Here in the United States, the Pfizer vaccine is still going through FDA approval, which should be shortly followed by the Moderna vaccine, and we will probably see those begin vaccinations before the end of the month. There has been some kind of problematic news coverage around this as saying that the UK has somehow beaten the United States in vaccine approval. That's kind of a bizarre way to look at it. Both countries have very different methods of vaccine approval. The FDA's is a lot more rigorous. The UK doesn't exactly cut corners, but they do take a lot of their data from the manufacturer's own reports, while the FDA actually goes through the raw data and does their own analysis on it, which is on the whole probably better for safety. However, so far it seems like these vaccines are pretty safe, so we should be able to see them getting approved in possibly even the next couple of days. Also, the CDC has offered some options for shorter quarantines, basically saying that person can quarantine now for 10 days instead of 14 if they're not symptomatic, or 7 days with a negative COVID test taken in the last 2 days or so of the quarantine. These are some options to try to make quarantines a little bit more palatable for people, and hopefully this will catch most of the cases. There's some concern that perhaps this might miss a couple, but it's hoped that the number of increased quarantines made possible by these shorter terms would make that, would lower the number of cases getting out there overall. They've also recommended full quarantines for anyone traveling, which a lot of states, especially us here in Massachusetts, have had those already, but this is a new policy there. Now, these, of course, are just quarantine periods, not isolations. They have not made a change yet to the time period a person needs to stay in isolation after they have tested positive, though there has been talk of some changes to that in the pipeline as well. And also from the CDC this week is they have approved their recommendations for vaccine distribution, which there's not really any surprises there, starting with healthcare workers and residents of long-term care facilities. Together, those two groups account for about 24 million people in the United States. And so fortunately, we may actually have that many vaccines between the Pfizer and Moderna vaccines around the end of the year. So they could very rapidly get most of our healthcare workers vaccinated within just a couple of weeks of the vaccine approval. Of course, you have to remember there is 3 or 4 weeks between the first shot and the second shot of the vaccine. So one shot is not going to put people into immunity there. And you can find sources for our stats and trends at the COVID tracking project for the wonderful graphs and charts, New York Times for the raw numbers for the world and the United States, and mass.gov for the Massachusetts numbers. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and be here if you need us. Stay safe.